Oh.
Scenario start. Music. We're gonna have you guys wear sunglasses.
Okay.
Scenario. And then you'll get your debrief from doctors.
We have to wear these the whole time?
Yes.
So, okay. Prescription.
Question.
When you talk, in the radio, you're going to have to speak.
Maybe the bigger ones would be better.
You let me know, Charlie, what works for you.
That's fine.
You look good.
Okay, cool. That's all that matters.
All right.
I've got the headlights
Here's
on my back pocket.
debrief, and the 4 minutes will start now.
Good morning and welcome to your day of survival training. Today's exercise involves an emergency landing in which your pilot was incapacitated and you, the medical crew, must now navigate out of a dark wooded remote location to seek safety and assistance. Fortunately, you were not injured. However, your equipment and personal devices have been rendered useless. Therefore, as part of this exercise, your pockets must be emptied of all items, including watches, cell phones, pen lights, etc. You may leave these effects and your medical equipment here in this bag.
So no flashlights at all?
No flashlights.
And nothing on our flight suits?
No, no equipment.
Okay.
We promise we'll give it back.
That's fine.
Yes, sir. My level's good. I'm off right now.
Nope.
Okay, so we have to navigate out, basically, where we should look for landmarks once we land. We should try and, is it day or night?
It is dusk.
It is dusk. Okay, so we'll be able to use the sun at least to orient ourselves east-west wise and make sure that our pilot, see how our pilot's doing, and make sure that we don't need to extract him or her as well.
Is the
and that
aircraft on fire?
Sorry.
Is
Is the
it on
aircraft
fire?
on fire?
No.
Okay, so we don't have to do any emergency fuel shutoffs or anything like that.
So in addition, you are being provided with a compass,
Okay.
and you will need to head in the direction in which you last saw city lights, which will be this way
Hey.
across the front of the stage.
Okay, where's the other radio for the kid? Did somebody put it in there?
And finally, for the purposes of this exercise, please verbalize
Omar.
any scene safety concerns that you have.
Okay, could you put
However,
the radio?
you may then proceed under the assumption that the scene is indeed safe.
Okay, should we take the, should we,
You will leave your bags here.
okay,
Yeah, I was gonna say, because of the terrain, you can't carry your bag.
okay.
So, okay, let me take this.
All right, so the biggest thing we're gonna do is make sure that the helicopter comes to a complete stop, if not on fire.
Yeah, we
before
should probably
exiting.
go ahead and perform an emergency shutdown anyways.
Yeah,
even
and
if it
follow our
doesn't
egress
hurt.
procedures so
Yep.
that we meet at 12 o'clock after the blazing
50 foot
stop.
off the nose.
Yeah,
And do we have a patient on board with us?
No.
okay,
Oh, sorry.
sorry.
Thank you.
Any questions?
And do we have a survival kit on the aircraft?
No.
Okay.
I'll have to relay that back to our base. Okay.
You may proceed.
Okay.
So we have 4 minutes now, or
That's correct. Beginning now.
Oh, okay.
we go this way?
Yep.
Okay. All right, so at this point, our priorities are going to be, we've got our...
Help! Here, please help! Is our scene secure? Come here, please help me. Guys, I need your help. Hey, guys, I need your help right now. Yeah. Hello? Guys. Hey, my son fell and he's hurt. I need you guys. You have your flight crew up. Please help me. What are you doing? Guys.
Dad, help. So we'll go.
I know. I'm trying to get their attention.
We'll be with you in just a minute.
My
sir.
son fell. I need your help.
Okay, so.
Please.
need your help. Where'd you go?
I'm trying to get help, but these guys are ignoring me.
Okay.
Guys, I need your help like now.
Yeah, that's good.
Please come here. My son fell, and I dragged him into the cave because it's getting dark out. I need your help. He fell. It was like
Okay,
15 feet. He
so
hurt
what
his
happened?
arm,
Yeah.
and he's hurt, and he's in there. And I'm an EMT. I'm a volunteer EMT. I have his back with me.
Wonderful.
What kind of equipment do you have?
I don't know. I throw it together. I haven't looked at it in a while. But he's in the cave. It started getting cold and dark out, so I dragged him in the cave. You guys got to go in there.
So
and
what
help him.
happened to him?
He fell. He fell like off
How
the cliff.
far?
I don't
How
know, 10,
is he?
15 feet. He's 10.
Do you have a flashlight on you, sir?
No, I mean, I have
So
one
anyway-
here. Yeah, go
Can we
ahead.
take a look at what you have
Go
here?
ahead.
Okay. And does he have any medical problems, sir?
No,
Okay. All right.
Where were you guys,
we were just walking and he kind of got in front of me and fell down the cliff. And
Okay.
he's really hurt.
do you have any medical problems?
No, we need to get in there and help him.
So we want to do that.
Dad,
we
where
had
are
an
you?
emergency landing,
Help.
so we had to make sure our helicopter was safe
help
and
me.
not get into the
I-
anything like that. So we will be in there as soon as we can.
Dad, where am I?
I know, I'm trying. I'm coming.
This space is not.
Okay, great. All right.
We gotta go. I'm afraid. I
Okay.
think something's really wrong with him.
Okay.
He's really hurt.
We need to check on our pilot.
Dad, everything hurts. It hurts so bad.
I know. You know what? I'm
wanna
going
die
back.
in here,
I
Dad.
can't. He's right in there. You guys.
In here?
Yeah. Can we just go in there and help him, please?
Dad, don't leave me alone. It's so dark. Help me. Dad, is that you?
Jimmy.
Help.
Hey, Jimmy.
Please help.
Jimmy, is there any way that you can climb out here to us?
Everything hurts. I can't move. I can't feel my legs. Please help me.
Okay, Jimmy, I'm Dr. Charlie, and I have Katie. We're nurses here. We're
Where's
gonna
my
help you,
dad?
okay? He's with us. He's with us, okay?
We gotta go in there.
So you got him in there?
Yeah, I did.
Please help me.
He's scared. It's
I'm
kind
in
of
so
dark in there. He's
pain.
lost.
Okay.
Are you able to bring him out to us?
No.
Everything hurts.
We have to go in and get him.
Okay.
Do you want to go ahead and
Yeah.
so you can lead the
Yeah.
way?
Dad, where are
That
you?
aircraft is over there.
Dad, get me out of here.
No, I mean, if you want to,
Help me.
let's go in.
All right.
Dad, please help.
I'm coming.
Dad, is it you?
Okay.
Where are you? Please help me.
Okay.
I'm in so much pain.
These are our pilot and our aircraft secured. Okay.
Where is our aircraft?
I'm here. Dad, help me. Get me out of here.
Half mile away.
Guys,
So we
he's
have to
right
get to our aircraft.
Yeah, he's right here.
Okay.
He's right here.
Charlie, hold on. Let's stay within
Okay.
arm's reach of each other.
I've got.
Oh.
What
Dad.
happened, sir?
What was that? Where's my dad?
So do we have two patients now?
We have two
Please
patients.
help.
Okay, so sir, are you still there?
Dad,
Hey, sir.
where's my dad?
So
Let's
he's
feel
actually a
it.
higher triage priority at this point.
Okay.
Because he's verbalizing.
All right.
Where are you?
Let's
I'm
go
in so
ahead
much
and
pain.
continue to crawl
Yeah.
and see if we can. Do we have radio service that we can call for any additional help, any
Dad.
additional resources to help us extricate these patients?
Okay.
Okay, I've got a victim over here.
Okay.
So I'm checking for, sir, can you hear me? Can you hear me? Do I get it? So I've got moaning. All right, I'm gonna move up to the airway
Can
here.
you hear me, sir? Can you squeeze my hand? Okay,
I'm
so he's
performing
not
a jaw
falling
thrust.
my
I'm holding
dad.
manual inline stabilization.
down. What is his?
Do I feel a carotid pulse?
Yes, you. Okay.
Okay.
He's spontaneously breathing
Does it feel rapid? Does it feel slow?
as you feel it.
Oh, okay.
Okay, so I think.
Charlie, can you palpate? I'm feeling for. I don't. Can you feel a pulse on this patient? We've got still agonal respirations. I've got my hand on the
I
chest.
feel like I'm
I have
having
a
trouble
radial pulse.
breathing.
You have a radial pulse.
I have
Okay.
a radial pulse. So he's agonally respirated. He's got agonal respirations. I think we probably need to go ahead and try and start breathing, establish an airway for him since he's not protecting his
Okay.
airway right
So
now.
we need to find airway equipment in that bag. Have you found the second victim yet?
I have not.
Okay. You want to pass that equipment up to me? This patient is. Okay.
Okay.
There was airway equipment on the inside. And where is our second patient, Charlie?
Our second patient.
Can we bring him
Help
over
me.
next to this
I'll
one?
try and go ahead and see if I can
Help
get
me.
him.
Get me out of here.
I've got a mask. Do we have any oxygen source available?
I don't think so.
And does his breathing, I've got my hand on his chest. It feels like it must be, his respirations feel of reasonable depth, so I'm not sure that we need to necessarily assist him at
That's
this
fair.
moment.
That's fair.
But potentially, if we can find maybe an
Yeah.
oral or a
Okay,
nasal
so
airway.
he's got good chest rise bilaterally. I'm not feeling any crepitus over the lungs.
I'm feeling on his face and feeling his mandible.
His pelvis seems stable to me,
His
so I don't
face
think we
seems to feel intact.
need to teapot him.
So I'm not concerned about potentially
Okay. So,
putting in a nasal airway, something like that.
so Katie, what do you want
my
to
dad okay?
make sure that you want to try and assist him with some
I feel like I'm
breathing,
having
and I'll
trouble
try and go
breathing.
ahead and get his son over here. And
Yeah.
Then we'll go from there?
Yep.
Okay.
I've
Fine.
got a bag valve mask. I'm looking for potentially oral or nasal airways.
Okay, so Jimmy, is that your name?
Help me.
Okay,
My name's Jimmy.
Jimmy, I'm gonna come over to you, okay? I'm Dr. Charlie, okay?
Help, I'm over here.
Okay, Jimmy.
Please help me.
Charlie, is it possible that you could get him out of this
Ow.
cave and then we can bring the other gentleman out?
I'll try, yeah.
Okay, 'cause I
Jimmy?
think-
Ow.
Hi.
Where's my dad? Is he okay?
Your dad fell. We're taking care of him. We're gonna try to get both of you out of here, okay?
Okay.
Okay.
I'm really scared.
Where are you hurting, Jimmy? So his
Everything.
airway's intact.
Everything hurts.
Everything hurts? Okay.
My chest is really hurting.
Your chest is hurting you? He's got equal chest rise.
Hey,
Asymmetrical?
sir,
Okay.
is he responding at all? Is he still?
All right, so we may need to
Okay,
worry about a pneumo
unresponsive.
later, but for right now, I think we have to try and get you into some daylight here, okay? He's got a good radial pulse. Pelvis seems stable. Does it hurt in your legs? Okay, all right.
It all hurts. Everything hurts.
No crepitus, okay. How's your neck?
I don't know.
You don't
Everything
know.
hurts.
Okay, so Katie,
Why don't you go ahead and get him out and then we'll get this one out?
is there anything there we can use to bind his pelvis? He's got an unstable
Oh.
pelvis and some asymmetric breath
There
sounds.
was a SAM splint, but that's not probably going to work for his pelvis. Do
He's
we have
a small
sheet?
kid, actually.
Oh,
You can-
okay.
if you have a sheet, we can tie the sheet. If there's any sort of sheet or anything like
I'm
that.
not feeling anything
well,
like that.
Okay. All right.
I've got a stethoscope here. I'm going to listen to this
I
gentleman's
feel like
breath
I'm having
sounds.
trouble breathing.
Okay. Is there a needle or a knife in there, Katie?
Hold on one
Hold
second.
on. I'm gonna try and move you back over here, Jimmy, towards my partner and your dad. Okay.
Ow.
Hold tight.
Ow. That hurts.
Okay. How are you doing over there, Katie?
So I've got bilateral breath sounds. I found a stethoscope. The flashlight is not
My
working in
stomach
this
really
bag.
hurts.
Okay. I need a knife or a needle to decompress his chest, and I need something to bind him. I'm gonna come back towards you.
Okay.
And we're gonna look in here.
I've got most of the. If you want to keep looking through the center contents of that bag and see what you can find. This seems like potentially.
What happened? Why am I
I
still
have
in here?
gauze of some type. I have I think it's. That feels like gauze of some type. Water.
Am I gonna die?
Does he have
I feel like
any
I'm gonna die
external
in
bleeding
here.
that we can find? As I'm going down this gentleman's arms here, do I feel any obvious
can't
signs
breathe.
of hemorrhage?
I really can't breathe.
Feel it. Okay.
Somebody
we're working
help
on
me.
this, Jimmy.
Please help me. I can't breathe.
Pill bottles. I have a safety scissors. That's not going to work to cut.
I'm just trying to make sure we're
Does
not
he
missing
have a pocket
anything
knife
over
or
here.
anything?
Let me look in his pants.
Help me. Help
See
me.
what we got.
Please don't let me die. Don't let me die. I'm gonna
The stuff that I
die.
have out at the head, Charlie, is
can't
just the
breathe.
bag valve mask, and we do have a king
Okay.
airway that I could
Okay.
feel, and there's a syringe there.
Okay. But
That's what I've identified as far as equipment. Are you
Okay.
able to find any other?
No, I found
Equipment
a
in there.
small, what feels like a small.
Mom.
Can you bring him over next to?
I can't. I'm not able to.
Okay, can we move this gentleman over next to him then,
Possibly.
potentially, so that we could be
What's
closer?
happening?
I've got a syringe.
Could we
as
use
well.
this guy's pants maybe to bind
Yeah,
his
that's a
pelvis?
good idea.
All right, so you want to help me get his pants off?
Okay.
Can you lift him up there, Charlie?
Got it.
And we don't have any additional help here with us, correct?
Oh, my stomach.
No, okay. And we're not able to get a hold of any help.
Oh.
What's the temperature outside right now?
Oh.
All right. All right, so Charlie, I've got this guy's pants
Okay,
off.
great.
I can go, you want to bind his pelvis?
Yep.
Can take those pants. I
Okay.
don't feel anything in the pants that would be
Okay.
useful at all at this point. And I'm doing again a secondary
Jimmy?
survey of this
How you doing,
patient.
Jimmy?
I don't feel
I'm gonna.
anything abnormal. I've still got a good, strong femoral
Jimmy.
pulse, but he's still unresponsive.
Okay.
I've got tape
Does he have any
here.
external signs of like any pooling blood or anything I can feel? Okay, just the pelvis and the chest. A lot of pain. Okay, so he's got an open right forearm fracture. Okay. All right. Okay, we're gonna go ahead and tie around his pelvis to stabilize that. Dad's
I
pants.
found the SAM splint. What do
Good.
we?
We need a splint for this gentleman's right forearm.
Okay. And then I think, let me see.
Okay. And
I've got. Is this,
I have a safety shears, but I don't think that's gonna work to vent his chest. Is there anything in there we can use to needle his chest? Jimmy.
I'm not palpating any. Do we have a? Even if we just have like a pen or something. I've got.
Doing the jaw thrust on him to help assist his breathing right now. We need an exit strategy here.
Yeah, I know. That's what I was trying to think of. If there's any other possible.
I mean, our helicopter should have launched an emergency beacon when we landed.
Yeah.
But that's still, pretty far away from us.
Hopefully the emergency locator was turned on before we.
Okay.
Charlie, I've got this King Airway. If we.
Okay.
I'm still just looking for other
Yeah.
equipment. So I've got the King Airway and the splint.
Okay. We'll bring
Do you,
that over
can we,
here.
now that we got his pelvis bound, can we bring him over here? What is, okay, so there's a skeleton in here? Alright, it's not a real person. We don't have any other, just making sure we didn't miss any other victims. Okay, I'm
Okay.
here. Why don't we go ahead, do you want to go ahead and slide him over? So he's not even making any noise anymore. So if
No.
I open his airway, that's it,
Okay.
okay. So,
You
can we
said there's a
move,
stethoscope in there?
he's what?
CZ. Okay.
Do you want to ventilate him? Do you think he's, Charlie, are you concerned for like a closed head
I'm
injury?
concerned now that he's got a closed head injury. We don't have anything to use to control the seizures. Obviously, we'll make sure that he's,
We can't assess his pupils because we don't have light.
we can roll him using C-spine precautions to make sure that he doesn't aspirate on himself, but I think we need to put a king in.
Okay.
You said you had a king airway?
Yeah, I brought it over. It's,
Okay. Why don't we go ahead and secure that?
I thought I brought that over.
I'll start bagging him.
Is it on the ground? I think it might have come out. That's the
I've got a
splint.
bag here.
Oh, shoot. Shears. I thought I brought that over. There's the bag valve mask there, Charlie.
Yeah, I got it.
If you need it.
Okay, so I'm assisting him
Hold
with
on.
bag respirations here.
Wait a minute, I may have found, this feels like IV tubing.
Okay,
We've got IV fluids.
okay,
I've got a needle. Do you want to decompress
Yes.
him?
yes. I'm gonna decompress the child's right chest here.
All right, so
Good.
here's, let me hand you the catheter.
Okay.
The cap is still on.
Okay, so you have the stethoscope here?
I can go and grab it. It's
Okay,
next
you
door.
said there's asymmetric chest rise on the left?
Oh,
On the
no,
right,
yeah, it's
okay.
around
We're gonna go ahead and needle his right chest then. Second intercostal space, just mid-ax, just in the
Mid-clavicular.
mid-clavicular line. Okay, and then afterwards, you wanna listen
I'm
to him?
listening, yep.
Okay,
Go ahead and ventilate him, I guess.
I am. I'm not getting a good seal here with this. Okay, there we go, okay.
Are you ventilating?
Yeah.
What happened?
Hey,
Go
I
ahead,
think
give me
you fell
another
and
breath.
got knocked out. Are you over there, man?
Give me another breath. Okay. Again.
What happened? What are you doing?
We're trying to take care of your son, sir.
I've got bilateral breath sounds, but it sounds diminished on the right. Is he
Okay.
difficult to bag?
He's bagging fairly. Yeah.
Is he?
Yep.
Do you think we should go ahead and decompress the other side?
No, I don't think so. I think you got better sounds on that side. I think we should go ahead and put the king in though.
Okay.
Where'd the king airway go?
Let me see if I can grab it. How's this guy doing over here?
What are you doing?
Hey, sir. Sir, how are you doing?
What?
Sir, how are you doing? We're trying to take care of your son over here. Do you know, is there any other way out of this cave? Do you know if there's another way to exit out of here safely?
What cave?
Where we are right now. Sir, do you know what's going on?
What?
Try to take some big deep breaths for me, okay? We're working on your son over here.
My son?
Yeah, you were out with your son today.
Huh?
Charlie, I'm having trouble finding I had the king. Now I can't see.
Okay, well, come over here and bag him, and I'll look for it. Okay.
Okay.
Do you have a splint?
I thought I had brought it in that bag over there, but I'm having trouble locating it.
Hey, where you going?
Sir, we're right over here, okay? We're taking care of your son right now.
Yeah.
All right,
Go ahead
so
and take over bagging
yep,
for
I've
me.
got a modified jaw thrust. I'm gonna continue ventilating him.
You think we should start a line and try and get him some
If we
fluids
can,
do
yeah.
that blind?
I didn't feel an IO in there. That would be ideal, but
Yeah.
how old is he, Charlie?
How old is your son?
Hey, sir, can you hear me? How old is your son?
What?
How old is your son? Just based on his
Size,
size,
I'd estimate him to be
maybe
about, like,
7 or 8.
8,
Yeah. Okay.
All right, so I've got
So we'll try to ventilate him about 20 times a
Yeah.
minute.
IV start supplies here. I've got tape to secure it.
Okay.
This feels like,
Do you got a tourniquet that you can put on to try to?
yes, I've got a tourniquet here.
So I'm trying to think if there's. So we have no egress options. I'm not.
Yeah.
We need to be thinking long term and how we're going to get out of here.
Okay.
So I think once we get him stabilized, one of us needs.
Okay. All right. So I have a tourniquet up. I don't have something to. Oh, here's something to clean the site.
Okay.
Okay. And go ahead and stick him. Okay.
Okay.
If I pull the needle out, do I feel
Do I
blood
feel
on
a
my
rush
glove?
of blood?
Okay. And if I pull the tourniquet out, is there anything? Okay. All right. So we'll forget the IV attempt then. I'm gonna go try and find airway.
And then I think once we get his airway stabilized, our next plan needs to be a method of egress. Hey, sir, how are you doing over
How
there?
you doing there, sir?
Can you talk to us?
What's going on?
Charlie, can you drag him over here so that he's closer to us?
Yeah. Yeah. Sir, are you able to help me get over towards your son? I found it's not a king, it's a
Time.
Oh my God.
All right.